Welcome back to Health in Today's Woman. Tonight we're talking about urinary incontinence or urinary leakage, and I'm being joined by Dr. Barry Jarnigan, who is a urogynecologist and the medical director for the Center for Female Pelvic Health, which is the division of the St. Thomas Health Services in Cool Springs. And Barry, our first segment we talked a little bit about some of the different types of urinary incontinence. In this segment I really want to focus in on one type, and that is this type of stress urinary incontinence. Can you give us kind of a little bit of a refresher, we talked about a little bit earlier, about what stress urinary incontinence is?
Again, stress incontinence is when there is a weakness along the urethra, and everybody wants to talk about their bladder, but really it's a weakness at the level of the urethra. And so the urethra is traumatized at the time of childbirth or prior surgery or some other reason, and so there's a weakness there. So when there is abdominal strain, i.e. laugh, sneeze, cough, some sort of abdominal strain, then they will, the pressure inside the bladder will overcome that weakness and they'll leak urine.
Now I want to take a second here just to explain one thing. Now the urethra carries urine from the bladder out. So a lot of people get confused, but the bladder out. So we're talking about the bladder, urethra, and then the outside. So it's a weakness in that area.
Correct.
Now, is there any medical treatment for this condition?
There is a medicine that has been tried in these patients, and it does have some efficacy. And in women who just cannot have any kind of surgery, it's something that could be tried. Typically, though, the side effects are not something that the patient is willing to accept, and so it's not used very often.
Now, that would lead us to the second part, which is the fact that this is a surgical fix.
It is a surgical fix, but it can be, there are office procedures, minor procedures that can be helpful in treating urinary incontinence. Women can come in and have what's called a bulking agent, where some medicine is put around the urethra, and it will help bulk that area up, and they will get resolution of their incontinence just by a simple office procedure. Now, the downside is it doesn't always work, but the plus side is they can come in, they can have the procedure, and they can literally be shopping in the mall an hour later. There is no recovery time. So that's the advantage of it. And so it's quick, it's simple, it's easy. There really isn't any real risk to it. It's more a matter of will it work, will it not.
Now I want to get to the devices that we have, but I want to mention one other thing first, and that's the idea of Kegel exercises. A lot of people are told about these. Can you give me a real brief understanding of what Kegel exercises are?
Kegel exercises are the muscles that surround the pelvic floor, and it's a matter of contracting those muscles, and those muscles will tighten in and around the urethra and pelvis and help hold back the urine, if you will. It's kind of like when people don't think about the pelvic muscles, but they know all the muscles around the knees. People know that if they have knee injury, they'll rehab the muscles around the knee to try to prevent having to have surgery on their knee. It's the same concept. They want to rehab, if you will, the muscles surrounding the pelvis to try to help compensate for that weakness along the urethra. And it's highly effective. Either Kegel exercises, there are things that we can use to help women with Kegel exercises. Okay. Vaginal cones can be very helpful, where there are little weights that you can put in the vagina and squeeze on, and it gives the patient the ability to note whether they're squeezing the right muscles or not.
Okay. Now I want to get to these because I want to make sure we get to do these. Now this, I want you to hold it here. Tell us a little bit about this, because this is one of the surgical treatments for stress urinary incontinence.
This is a sling-type device, and it's one of the newer sling devices, and it's what's called a single incision sling, where there's only one little incision about this big in the vagina right over the urethra.
Okay.
And then this fits in, and if you use my finger as the urethra, it fits in just around the urethra like that. And it's a fairly simple way of fixing urinary incontinence. It's outpatient. Women come in, they have it done, they go home the same day. Most women who have this done tell me they rarely hurt, that the only reason they know they had surgery is because their leaking is gone.
And this is done in the office, or this is done in the operating room?
This is done in an operating room, but as an outpatient, where they come in the morning, go home a couple hours later. We're thinking about looking at doing these in the office, but we haven't moved there yet. But it's a fairly simple, easy way of treating urinary incontinence if they have, a mild to moderate type incontinence.
Okay. I want to make sure we get to this other device because you're one of the only people I've ever heard who does this. And this is something I want to talk about. This is a device that you can use for a patient who's had really severe incontinence that's not getting better that allows you to address this a little bit easier. I want you to explain that to us.
I use this type of sling in two occasions. One is exactly what you described, the most severe type, where the urethra is depicted as this kind of tube here, but where the urethra just doesn't work at all.
Okay.
That would be one reason. The other one is in women, and this is for those women who are out there who have had surgery and for whatever reason it didn't work. We know that with these type slings, the success rate is about 85%, which is very good, 85 out of 100, but there's 15% of women who don't get help. And in those women, you still can get help, and that's where this comes in.
Okay.
And this sling works in people who've had prior surgery, but it didn't work for whatever reason. And this is called an adjustable sling, and the sling fits down, and I think I can get it off here. But the sling fits down under the urethra, and this is depicted as the abdominal wall. And so the sling goes down under the urethra, and it comes up to the abdominal wall, and then they actually go home with this little plastic device coming out and taped around it like this, and they come back to the office, and we put this little screwdriver in, and you actually can adjust this sling, and that's why it's called an adjustable. Okay. You adjust this sling until they're dry. And so it's virtually 100% effective. And so you adjust this sling, and then once you get them dry, then you merely just pop this off, and they have this little, what I call a button. They have this little button here sitting just under their pubic bone. Okay. And so they go around, and so if years later their urethra gets worse or whatever, you just reattach this and you tighten it up a little bit more. And so there's always a way to make them continent.
We're going to be back right after these messages, and then we'll address this a little bit further. So we'll be right back after these messages.